Hello, my name is Sharon Turbin, and I'm a kidney doctor at Johns Hopkins. I'm going to be talking about nutrition and kidney disease, which is a really important topic. So thank you all for joining. What we're going to talk about is the importance of diet for individuals with chronic kidney disease. So we'll talk about some dietary recommendations, including foods and drinks to avoid and not avoid, and also how we assess if patients are following dietary recommendations. So one important question is, how are kidneys involved with nutrition? So just to give you some background to help understand the importance of nutrition. So kidneys clean the blood and remove fluid, and kidneys balance the amount of potassium, phosphorus, and calcium in the blood. So some dietary content, such as sodium and protein, can actually affect the kidneys in harmful ways. So when someone has kidney disease and the kidneys aren't functioning normally, there are levels of certain minerals that can become too high. And some examples of this are potassium and phosphorus. In some settings, patients can actually become overloaded with fluid if they're not able to make enough urine because of the kidney disease. This is not always the case, but sometimes in advanced kidney disease, this problem may occur. So in terms of kidney disease, again, I just want to give you some background into this. There's one type of kidney disease is called acute kidney injury, and that's sudden kidney damage that may only be temporary. Then there's chronic kidney disease. And this is where kidneys lose their function over time, and eventually this may lead to the need for dialysis. Causes may include some of the things that are listed here, like high blood pressure, diabetes, genetic diseases, and autoimmune diseases. This is something I put here, just something that so you'd have a reference. This refers to the stages of kidney disease, just to kind of give you an idea and maybe see where you're at on the spectrum. Stage 5 is around the stage where patients tend to need dialysis, and stage 1 is very mild disease. All right. So we're going to talk about eating well in chronic kidney disease. So during this talk, I want to try to give you some pointers, some things to look out for, but I really want to stress the importance of speaking with your healthcare provider and hopefully a dietitian as well, because it's really important to know exactly what's specific for you, because every patient's different. And working with a dietitian may also help give you some tips that you may not have thought about. So in terms of chronic kidney disease, a proper diet is very important for many reasons. Some food ingredients, such as sodium, can harm the kidneys and other organs, such as the brain. There may be increased chance of heart attacks in patients who eat a lot of salt, for example. And it can also increase the chance of having kidney injury. Some patients with kidney disease may actually not eat enough food because they may not feel well and have a poor appetite. And also a lot of times, individuals with kidney disease are told not to eat certain types of foods, and then they don't know what to eat. So it's like, don't eat this, don't eat this, don't eat this, don't eat this. And what are you really left with? A piece of lettuce. And in some patients, they can't even have dark lettuce if they're on Coumadin, for example. So it can be very overwhelming, and that's why I want to kind of help talk you through it and sort of stress the importance of really learning about this and, looking at their resources and making sure that you are eating properly and getting enough nutrition and the proper type of nutrition. So it's really important to limit the intake of foods and drinks that can cause problems, but also to make sure to eat enough food to avoid poor nutrition. So again, if patients are avoiding so many things, which I understand because they're told don't eat this, then patients can just be so afraid and get malnourished, and that can lead to other problems. So what are some aspects of food that patients with chronic kidney disease should think about? So one is calories. There's fats, carbohydrates, and proteins. Those three factors make up caloric intake. Sodium, potassium, in some patients, not all. Phosphorus, again, in some patients, not all. Calcium, protein, and fluids, again, for some patients. But these are sort of the main categories to think about. and also vitamins. So it's also important to remember that, or to know that food labels are not geared toward chronic kidney disease patients, unfortunately. So I know this is a busy slide. You can pause it or look at it later, but basically this is the structure of a typical food label, but it doesn't, not all food labels will have all these factors listed. So for example, this particular food label lists potassium, but most of them don't. But this is just kind of to show you the structure of a food label. So again, potassium and phosphorus content are typically not listed. So this is especially a problem for patients with chronic kidney disease. And the daily recommendations differ. So when you look at, on the right side there, the percentage, that might be different for you and even for other disease states. And also something important is there may be more than one serving per container, even when the container is small. So it may look like something only has one serving and there's a certain amount of sodium, for example, but when you read the label, that little container has 2 servings. So that's a lot more sodium than you even would think. So we'll start with calories and kind of we'll go down from there. So caloric intake in general is made up of 3 things: fat, protein, and carbohydrates. So for chronic kidney disease, again, every patient is different. It depends if someone's diabetic, for example. But in general, the goal is to have less than 30% of the caloric intake from fat, especially saturated fat. So that's the worst kind of fat. Protein approximately 10%, and carbohydrates approximately 50 to 60%, but that may need adjustment for diabetic patients. This is one of the themes here. It's not one size fits all. So in terms of caloric intake for CKD patients, and this is not something to overwhelm you or memorize, it's just sort of to give you an idea of kind of where we're coming from. So this is sort of the recommended caloric intake, but it depends on so many factors. It depends how active you are and other things, just your body weight. But this is sort of a reference just kind of for your knowledge. So if somebody is obese, then it may be important to limit the caloric intake. So again, everyone's different. So what are some challenges of reaching the recommended caloric intake? So decreased appetite, as I mentioned before, may occur with worsening kidney function, or even if there are other medical problems that a patient has, they just may not be hungry, or they may be depressed. There's so many reasons that there may not be a great appetite, and those should be discussed with the provider, but that can be a challenge. And then also patients may not eat enough, again, like I was saying, because there's so many restrictions. And also, when there's restrictions, then again, what do I eat? And some patients may also not have as much access to eating healthy foods. So those are also limitations that may occur. So obesity, the heart, and kidney disease. So we're actually now talking about the heart. We're including that in our discussion of the kidneys because everything's interrelated. So obesity, high sugar intake, high saturated fat intake, they all may lead to kidney problems, heart problems, and diabetes. And so like I was saying, diabetes is one of the most common causes of kidney disease. And a poor diet can really cause a lot of problems. So it's really important, even though we're talking about kidneys, to also eat heart healthy foods because they're actually kidney friendly too. So avoiding fried foods, trying to eat grilled, steamed, baked, broiled, roasted, basically avoiding fried foods. Trimming fat, avoiding cooking with butter, limiting intake of saturated and trans fats. Those are the worst kinds of fats, like I mentioned. And in general, eating more plant-based foods and more, vegetables and fruits. But the caveat, unfortunately, is keeping in mind that some fruits are high in potassium, and we're going to talk about potassium soon. So first, we're going to talk about sodium. So sodium chloride is table salt. So when you hear the term table salt, that's what it's referring to. So consuming too much sodium can actually increase blood pressure. And this is a huge problem. If you even give somebody who doesn't have blood pressure problems this huge load of sodium and look at the blood pressure, there may be elevations. So it's something very, very important to think about and to address in your diet. So eating too much sodium can also lead to leg swelling and fluid overload, and it can harm kidneys and other organs. Even if the blood pressure doesn't go up, there's actually some evidence that it may harm the kidneys and other organs. And the problem is that sodium is everywhere. I added almost because obviously it's not everywhere, but I wanted to make a point that it's really hidden in a lot of foods and drinks that you wouldn't even think about, maybe. So it's really important to try to be aware of these. So we're going to talk about that. So what is the highest amount of sodium intake recommended in chronic kidney disease? Several health organizations recommend not consuming more than 2,000 milligrams, which is 2 grams of sodium a day, which is the equivalent of 5 grams of salt. So if you see sodium, that would be 2 grams, but salt includes sodium and chloride, so it would be 5 grams. This is one recommendation. There's actually various recommendations, and it's still somewhat controversial, but that's pretty much a common recommendation. Some health organizations even recommend consuming no more than 1,500 milligrams of sodium a day for people who have chronic kidney disease. Again, that's controversial, but in general, since we need to sort of pick something to guide our patients, we usually try to aim for around this 2,000 milligrams because that seems to be a range that's possible and still would be beneficial. There's so much sodium everywhere that it's even hard to even get to that 2 grams a day considering the amount of sodium that's added everywhere. There's no perfect way to figure out exactly how much sodium we need. There have been studies that compare different levels and look at different outcomes, and this is kind of where this number comes from. So most adults eat too much sodium. So this is a bit of an older data, but it basically shows you, this is in chronic kidney disease, this is sort of that upper limit, 2.3 grams is sort of what's recommended for the general population. And you can see that most people are eating more. And this is, of course, not perfect. It just tends to be from surveys and sometimes from urine studies. But the point is that most people are eating way, way, way too much sodium, even when they think they don't. So it's good you're here to listen because that means that you want to make that first step to lower the sodium intake. So how do you decrease sodium intake? So something important to keep in mind is that most of the sodium intake comes from processed foods from the grocery store. Now these are not perfect numbers, but it sort of gives you this idea. There's the amount in restaurants, the amount added in cooking, and there's some found naturally in food. But processed foods are really problematic. So this is just a little bit of a guide from the USDA. And I just sort of picked some foods that they had listed and listed how much, what this approximate sodium content is, just to give you an idea. I mean, these are not exact. And obviously it depends what kind of soup, etc. But there are types of soup that may have, 3,000 milligrams of sodium in the serving of soup. And in the whole day, you don't want to have more than 2,000, and this has 3,000. So this is obviously a problem. And so, again, this is a guide that you can look at later. You can also, of course, look at the website and other reliable sources to help you sort of get an idea of how salty things are. But again, looking at the label obviously would be of what you're particularly eating would be important. But sometimes you might order something like from a deli or something that doesn't have a label. So it's just important to kind of, in your mind, have an idea of things. But even when you do order from the deli, they should have the original packaging. So you can always ask for that or look online if it's a national restaurant. So what are some tips to lower dietary sodium intake? So it's really important to try to limit your intake of cured, pickled, processed, canned, and or packaged foods. For canned food, sometimes if there's like canned vegetables, you can rinse it before eating. That may help a bit. And limit the intake of soups. They're full of salt, unless you make it yourself and can control it. Even the low salt soups, while they're better, they still may have more sodium than is ideal. Frozen dinners are notoriously very salty. Instant noodles, lunch meats, salty snacks. Monosodium glutamate is that infamous MSG that you may hear about, especially with things like Chinese food and other types of foods. Pickles and olives are typically salty. And like I was saying, it's important to read the food labels and to see how many servings are actually in the package. So what do you look for on the nutrition label? I showed a label before, and this is just kind of to reinforce this. So for example, we talked about the serving size. Again, this is just sort of a reference for you to look at. I don't want to overwhelm you with this busy slide, but basically one of the points of this is to keep in mind that these percentages may not reflect what's important for you. It's just sort of general recommendations. So it may be better, for example, that you consume less sodium. And again, you can see this label doesn't have the potassium and the phosphorus because most don't. This is, again, an older slide, but it's to show you that high sodium foods are not the only source of sodium. So if you like to eat foods that have, moderate amount of sodium, but you really like to eat them and you're eating a lot of them, it could add up. One example that I think it's important to stress here is a salad dressing. So salad dressing might be a little amount, but it's something, sometimes people kind of add it, and it can actually add a lot to the sodium intake in your diet. And it's also unfortunate because a lot of people try to eat healthy foods like salads, but then when the dressing is on top of it, it kind of defeats the purpose. So again, what can you eat? I don't want to be negative. You can't eat this, you can't eat this. So let's say, what can you eat? So fresh and unsalted foods. You can cook healthy foods at home without adding salt. If you go to a restaurant, that's tricky because a lot of times it's ready made, or it's more difficult for them not to add the salt, and they may not be able to limit the sodium intake, but you can always ask the staff. And a lot of patients really like to add these other flavorings. Mrs. Dash is a big one, and other spices, vinegar, lemon juice, peppers. So there are other ways to make the food a little bit more interesting tasting, less bland. Something to really keep in mind is that when you see a salt substitute, a lot of them are actually potassium. So they're potassium chloride, for example. And if you do have problems with high potassium, or even chronic kidney disease where you might get into that situation, that is something that you want to avoid. So it's probably better at this point to stick with these other options instead of the salt substitute that's potassium. So how do you know how much sodium you're actually consuming? So some patients think, which makes sense, that if you look at your blood work and you see your sodium levels normal, that everything's good. But actually the blood sodium level has really nothing to do overall with how much sodium you're consuming. It tells us about your fluid status. So most people's sodium level is normal because if they eat a lot of salt, then they tend to drink more, and then the sodium level isn't high, but that doesn't mean that in your body you're okay. It just means that the blood sodium level is fine. So I just want to make sure that patients don't think that, oh, everything's fine, just because your blood sodium level is fine. Sometimes we can look at a 24-hour urine collection. That would reflect what you ate the day before. It may not reflect what you eat every day. The one-time urine sample is less helpful, although for patients who are not on a diuretic and not on an ACE inhibitor or an angiotensin receptor blocker, we can actually use a one-time urine sample to look at the ratio of sodium and potassium. And in many cases, that can actually be helpful. So that's something that you can speak with your provider about if you're not on a medication that causes you to have high or low potassium levels. It's called a urine spot potassium and sodium level. So if you have a lot of leg swelling and you try really hard and lower your sodium intake and you notice your leg swelling improves, it may mean that your sodium intake has actually decreased. Not necessarily, but in many cases, it could be that. So that's a way that you can sort of kind of monitor yourself. And meeting with a dietitian can be extremely helpful because you can sit with them and discuss what you've eaten, and they can advise you. So the next topic is potassium. We've sort of touched on it a bit. But potassium is very important for the body, including heart and muscle function, and it can actually lower blood pressure. And that's why there's this push to have people eat fruits and vegetables, particularly a lot of fruits that are high in potassium. That's for the general population. But when we talk about kidney disease, sometimes we need to be a little bit careful about potassium. So again, many healthy foods contain potassium. I'll show you examples soon. But kidneys that are not functioning normally may not be able to remove enough potassium, and a buildup of potassium in the body can be very dangerous, and it can even possibly lead to death, and that's how serious it is. And so that's why it's really important to know what your potassium levels are and to discuss with your provider, how much you should eat, etc. And the level of potassium doesn't necessarily correlate with how much you're eating. So some patients have high potassiums even though they're really eating all the right things. It's just a combination of maybe medications that they're on, and just sometimes the body just can't get rid of potassium. So it's, like I said, it's not just what you're eating, but what you're eating can affect your levels. Another important point is not every patient with kidney disease needs to lower the potassium intake. So sometimes you may hear potassium kidneys, it's bad, but it's really important to speak with your provider. There are patients who have kidney disease and they've never had a problem with their potassium levels. They may even have low potassium levels if they're on a diuretic, for example. So it shouldn't be something where you say, oh, okay, kidney disease, lower potassium. It's not something automatic. And again, I'm stressing the point that every patient is different, and it's important to see what works best for you. So here's my point again. So the medications that I was mentioning that can raise potassium, these are just some examples. The ACE inhibitors, which are very commonly used in kidney disease. And when I say raise, it doesn't mean it's going to be extremely, extremely high, although it could. These are really good medications that can raise the potassium a bit or more than a bit, depending. And then the other ones I listed, the angiotensin receptor blockers, there are diuretics. Some diuretics help people lose potassium, or they cause patients to lose potassium, and some diuretics cause patients to retain potassium. So it depends. So the ones I listed are the ones that cause patients to retain or keep potassium. And then non-steroidals, that's the whole NSAIDs that you hear about, and we do not recommend NSAID use in kidney disease. It can cause problems, and it can actually harm the kidneys. But something else it can do is also raise potassium levels sometimes. Again, just because someone is on this does not mean that they will have high potassium levels, but this could happen. And I was saying that some medications can lower potassium, and then these are some examples. Lasix, hydrochlorothiazide, Bumex, those are diuretic pills. And there are some patients with kidney disease who are on these medications, and their potassium level is so low that that can be a problem as well. And they may need to consume more potassium or even take potassium pills. And this is, again, why it's important for you to, I'm sounding like a broken record here, but I want to make sure everyone does understand the importance of knowing your numbers and talking to your provider about it. And if you're on a fluid pill, you may need to have your blood work checked regularly if you are having these problems with low potassium, because just like high potassium can be dangerous, low potassium can also be dangerous too. So how much potassium should you eat or drink? So again, it depends. In general, so if somebody has kind of like later stage kidney disease or has borderline high potassium, sometimes the recommendation is no more than 2,000 milligrams a day, but it's very variable, even more so than sodium, which is more of a, even though there's some controversy, it's sort of more of a one size fits most, but potassium is really, the intake recommendations are quite variable. So if somebody has only mild kidney disease and has normal potassium levels, they may be able to follow the general recommendations. One recommendation for the general population has been 4.7 grams, which is 4,700 milligrams a day, but that's actually recently been adjusted. But basically, if someone has a mild kidney disease and there's no concerns about high potassium, just eating fruits and vegetables and healthy food would be the way to go. You don't necessarily have to count how much. But again, talking to a dietitian can help you just to kind of make sure you are getting enough, because it's possible that if you do get enough potassium that your blood pressure may be helped by that. So here are some foods and drinks. The pictures are foods, but there's some discussion of drinks as well that are high in potassium. Some of them are pretty well known, like bananas, but there are other ones that I think people may not be as aware of. So this is for your reference. Some of them include, raisins, other things that are listed here. Just for the interest of time, I'll just leave that up. And there's references if you go to www.kidney.org, which is the website for the National Kidney Foundation, and do a search for potassium. They have a good list of high and then low potassium foods and drinks. So on that topic of low potassium foods and milk, drink, these are just some examples. So milk, regular milk, is on the higher side in potassium, but rice milk is not. So that could be an option for people who like to drink milk. That's another option for them. So what can you do to lower potassium intake? So if you do feel compelled to eat potatoes, for example, you can boil them or soak them to lower the potassium content. Better yet, avoid them if you can, but if not, this is just a sort of a tip. So some people really love mashed potatoes, and they can actually, you can substitute mashed cauliflower. Some people love it, some don't, but it's still something that can give you that same consistency, but it's not high in potassium. And we talked about avoiding salt substitutes. And also just avoiding preservatives that contain potassium. Going back to the food labels to reinforce that potassium is not usually found on food labels. So some people look at that and they don't see it and they think everything's fine, but it's usually not there. So you may need to go online and figure out how much potassium is in, it's not like a glass of orange juice, etc., or whatever it may be. Phosphorus. So we're moving on to phosphorus. Phosphorus is a mineral that's involved in keeping the bones, blood vessels, and other organs healthy. Healthy kidneys get rid of phosphorus in the urine. But when kidneys don't work normally, phosphorus levels can build up in the blood. And this can lead to problems. Some examples are brittle bones, and actually severe problems like heart and blood vessel problems, and also itching. So some patients are on dialysis, for example, and they may be itching, and that might be because their phosphorus is high. It can occur when patients are not on dialysis too, but it's just something to think about for patients who are itching. So how much phosphorus should you consume? So kidney disease patients may need to limit the intake to about 800 to 1,000 milligrams per day. But again, it depends on what your level of kidney disease is and what your phosphate level is. If your levels have been normal on what you're eating, you may not need to make any adjustments. It's also important to note that all phosphorus is not created equal. So your body actually absorbs about 70% of the phosphorus in foods like beans, legumes, and nuts, but it absorbs all of the phosphorus in processed foods. So if the processed food and let's say the nuts have the same amount of phosphorus, your body is going to absorb more. So it's actually worse for you to consume that processed food. So it's just kind of a side note just to keep in mind. So what foods and drinks are high in phosphorus? So some notable items here are dairy products, dried beans, lentils, and the other items listed here. Dark sodas, colas, that's a really big one. So if somebody does want to drink sodas, sodas are not ideal in general, but if there's a choice between a dark soda and a clear soda like a 7-Up or ginger ale, it would be better from a phosphorus standpoint to choose the clear soda. And also many junk foods. So when there are additives in foods, they often contain phosphorus. So here are some poor choices. So they have these pictures not to be mouth-watering, but to show you foods that you would want to avoid if you do have high phosphorus levels. And a lot of these are not healthy anyway, such as processed meat. So that's not healthy for anyone. But in terms of the phosphorus, these are just some, examples. This is something to stress, that most protein-rich foods are also high in phosphorus, but not always. And so this is important, for example, if somebody's already on dialysis and they are recommended to have more protein but not a lot of phosphorus, it can get tricky because most foods with high protein are high in phosphorus. For somebody who's not on dialysis, we don't recommend having a lot of protein. So a lot of these foods that are high in protein and high in phosphorus are best to be avoided. So this actually shows you an example of something like if you were to eat an egg, they're high in phosphorus, but the egg white itself is not high in phosphorus. So these are just, again, higher protein foods, and just to kind of show you the amount of phosphorus, which often correlates, but not always. Again, this is more for your reference. So we talked about food labels a lot, and we said that phosphorus is not found on the food label, but if you look at the ingredients, so you won't see it on the actual part that's shown on the right, but in terms of ingredients, whatever this item is, it's obviously not healthy with the sugar and corn syrup, and it contains trisodium phosphate. So there's all kinds of phosphate, monosodium, disodium. So if you just scan through the food and see anything that starts with PHOS, phos, that's not ideal. But again, you can, I'm sure, recognize the other unhealthy ingredients that are in this food item. So what can you eat or drink, right? That's important. So most fruits and vegetables are low in phosphorus. But again, you have to be careful about the potassium. So eat fresh foods when possible. Because again, things that are processed have a lot of salt and additives that have phosphorus. Try to limit meat portions. Try to keep milk and yogurt portions to half a cup. Try to limit cheese portions. And again, this is if you have high phosphorus levels or kind of are on that border. There are certain, of course, everyone should avoid junk food and unhealthy food if possible. But, when we talk about some of the other things like the dairy and things that you may be okay to consume that otherwise. And again, because everyone's different, it's important to check with your provider and dietitian. So some patients, they say, I just got to have my snacks. So we'd at least try to recommend snacks that are less unhealthy. So some of these are healthy, fresh apples and blueberries. And some of them are not so much, like, bagels are high in carbohydrates. Pretzels can be salty. So hopefully you would buy the non-salty ones. But just in general, these are examples of snacks that are low in potassium and phosphorus, if that's an issue for you. So what if your phosphorus level remains high? So there are some patients who they're really trying really hard, eating all the right foods, but the phosphorus levels are still elevated. And that's when you may be prescribed a phosphate binder. And those are pills that you take with the food. It binds the phosphorus, and then when you have a bowel movement, it comes out. And some people may say, well, how about I'll just eat all the phosphorus I want and take a bunch of phosphate binders? However, that's not ideal because there are also other unhealthy things in those foods. And also the phosphate binder doesn't get rid of all the phosphorus. It just helps things along. It helps your body to get rid of some of the phosphorus. So the next I want to talk about calcium. So the body uses calcium for many purposes, including to form strong bones and teeth, and for muscles and nerve function. So chronic kidney disease causes imbalances in bone metabolism, which can cause calcium to deposit in the blood vessels, and it can also affect heart function. So when you have your blood work, we can see the calcium level and see if it's in the normal range. And if it's not in the normal range, then your provider can discuss recommendations with you based on that. Calcium is not typically an issue like it is with phosphorus and potassium. People tend to have relatively normal calcium levels most of the time. There are cases, especially in advanced kidney disease, where the calcium level might be low. And there are also certain conditions that cause a high calcium level. So one recommendation is that the total calcium intake from diet and medications for kidney patients should not be greater than 2,000 milligrams a day. This depends on other factors. So again, one of the things to discuss with your healthcare team. But there are some patients who we do find have really high calcium levels, and it turns out that they're having maybe heartburn and are just popping Tums like candy. And so keep in mind that Tums does contain, or it's basically calcium carbonate. So it's just important to keep that in mind. Protein. So this is another important topic. So protein is important to help in the growth and maintenance of body tissues such as muscles. But too much protein can be harmful to the kidneys because it actually makes them work harder, or it can make them work harder. On the other hand, if somebody eats too little protein, they can actually get malnourished, which can lead to severe problems as well. So again, it's the what do I do? Can't have too much, can't have too little. So how much protein should you consume if you have chronic kidney disease? The exact ideal amount is not known, and it depends on the degree of kidney disease and your overall nutritional status. So there's many, many, many studies looking at this, and there's some controversy over how much protein is recommended, but there are some general recommendations. So typically, again, not to throw numbers at you for confusion, and if you need to pause this, feel free, of course, but the typical recommendation is between 0.6 to 0.8 grams per kilogram body weight, which is about 8 to 10% of energy intake. So if somebody weighs 70 kilos, which is 154 pounds, you would multiply by 2.2 from kilos to pounds and divide pounds by 2.2 to get the kilos. So a typical recommendation for this size patient is about 42 to 56 grams for someone who has chronic kidney disease, who's not on dialysis. If somebody is on dialysis, the dialysis machine actually can take amino acids from the blood, which is basically decreases the protein amount. And so patients on dialysis need more. It's recommended that they have 1.2 grams per kilogram body weight. So there's an important distinction. But right now we're talking about patients who are not on dialysis. So it's important to discuss your protein intake with your provider. Okay, so what are some examples of portion sizes? So sometimes when you look at recommendations, they may talk about serving sizes or portion sizes. When you have your food in front of you, is it like this much? Is it this much? It's not, sometimes it's not quite clear. So these are just some examples. Like an egg is approximately equal to 1 ounce of protein. Approximately 3 ounces of cooked meat, fish, or tofu is usually the size of a deck of playing cards. And a portion of dairy foods is half a cup of milk, yogurt, or a slice of cheese. These are just sort of guidelines, and you can look them up as needed. And again, this is, something that the dietitian can also help you sort of sort through. In terms of types of protein, there are animal proteins and plant proteins. So some examples of animal proteins are, of course, meat, fish, eggs, and dairy. And then for plant protein, which we will discuss more, there's beans, nuts, and grains as examples. So is there a difference? So that's a really important question that's been studied more in the last few years. So there are some studies in patients with kidney disease that suggest that plant protein may be healthier than animal proteins. However, it's important to use caution. So there are companies that have these meat substitutes, plant-based burgers, and those may actually be unhealthy because they're often processed and salty. So if you actually compare, the ingredients of meat versus some of these substitutes, it may be disappointing. And so instead of automatically choosing that, it'll be important to research it, and to discuss it, potentially with a dietitian, because that can be misleading. But in general, getting the protein more from plants seems to be best in kidney disease. So this is just, again, for your reference, not to go over necessarily right now, but to give an example of the approximate protein content of certain foods and drink. Again, this is also for your reference, but it's to show that we talked about the fact that most protein-rich foods are a source of phosphorus, and some also have high potassium. And the Na is sodium and PRO is protein. So again, these are just something added for your reference. And these are also just kind of more examples just to kind of get you thinking about different types of foods and drinks. So how do we, as healthcare providers, determine if you're eating an adequate amount of protein? So we can look at your albumin level, but that's not a perfect test because other factors can affect the level. So if your level is low, it could be that you are losing protein in the urine because of your kidney disease. And then we can also look at your BUN. If your BUN is very high, we may need to limit protein intake even further. These are not perfect, but these are just helpful. But these are not really ideal ways to look at your protein and intake. And that's why, again, meeting with a dietitian may be very helpful because they can really sit down with you and go over what you've eaten. These are just some examples, again, for your reference, just to see some typical fast food items and sort of how much potassium, phosphorus, sodium, protein, and fat they have, just to give you some ideas. Okay. All right, so next we're going to talk about fluid intake. And I know we're covering a lot of things going from foods now to talk about fluids. And I don't mean to overwhelm everyone with all this information, but I really think it's important for you all to really have a good understanding of why we're making recommendations and to know that every patient is different, and for you to take charge and talk to your healthcare team to make sure that you're doing the best you can to get all these things straightened out, to make the right food decisions, etc. So fluid intake. So again, this is not one size fits all. So some patients actually need to limit fluid intake, or they may become full of fluid. An example of this is somebody who has severe heart failure, or a patient with advanced kidney disease who is not urinating as much. So this is not necessarily something that everyone needs to do, but it's important to find out if you should, because if you're not able to urinate normally, if you have heart failure, etc., you might be at risk for getting short of breath and fluid overloaded. And then in that case, you may need to limit fluid intake. Some patients, for example, if they have Crohn's disease or other causes of diarrhea, they need to drink more to avoid dehydration or volume depletion. Those can actually cause kidney injury potentially. So it's important to figure out where you stand. It's also important when we talk about fluids to keep in mind that fluids is not just, water or juice or soda or something. So ice. So some patients, they like to eat trays of ice. They think, oh, I'm not drinking, I'm eating ice. But, it can be misleading, but there's if you melt a tray of ice, that's, can be a lot of water. So same thing, popsicles, Jello, soup, anything that's, made of water can be a problem if you're advised to limit your fluid intake. Another reason to avoid salty foods, as if you need more reasons to avoid them, but if you're at risk for fluid overload and you eat a lot of salt, it just makes people thirsty, and then you may drink too much and can have trouble with fluid overload. And that's actually a common problem we see, for example, in a dialysis patient who comes in after a weekend and they're overloaded because they were, at a barbecue or something, eating a lot of these salty foods. So how do we assess nutritional status in chronic kidney disease? So we can look at your lab work, we can do dietary interview or diaries, and that's usually something that the dietitians would work with you on. We can look at your changes in weight. The changes in weight could be fluid weight, they could be fat weight, it could be muscle weight. So these are all clues to see how you're doing. There's also other ways that, of course, are, but those are just kind of some basic things. So I also wanted to go over some additional recommendations related to diet. So one is to try to avoid high fructose corn syrup. Patients with advanced kidney disease should use caution with the regular vitamins, because some vitamins levels can be too high, like vitamin A and some of the other ones mentioned. If certain patients eat too much vitamin C, they can actually get kidney stones. So again, talking to your provider is important. Vitamin D levels should be checked by your provider to see if you should be on vitamin D pills. Many people are vitamin D deficient. And so it's important to know what your levels are so you can take the supplement if needed. And just to avoid heavy alcohol use, it's important just in terms of your entire body. So if you eat at a restaurant, what do? So you can speak to the staff about limiting salt, but many foods are pre-salted, and especially in a fast food, you probably won't have much luck there. You can ask for the nutritional information if it's like a chain, but they may not have information on potassium or phosphorus, but at least sodium. And actually, it's actually interesting to look at these nutritional handouts just if you're ever just curious, because when you look at them, it can be very shocking how much sodium is in some of these foods. If you ask for gravy, sauces, condiments, and all that, salad dressing, you can ask for it on the side. So if you feel you need it, you can just add a little bit. It's probably better to skip because a lot of those are very unhealthy. And then, of course, trying to avoid fried foods and eating more, broiled, steamed, or grilled items. Just some quick things about certain types of restaurants that may be helpful. In Italian restaurants, keep in mind that red sauces contain potassium typically, because tomatoes are high in potassium. So if they're red sauces from being made of tomatoes, then that could be a problem if you're someone who needs to restrict potassium. White sauces may be high in phosphorus. Pesto sauce could be a good choice if you need to have a sauce. Many items are salty. That's a common problem in all restaurants, pretty much. In Asian restaurants, again, most items are very salty. If you use soy sauce, it's important to use a low sodium version. However, even the low sodium version is actually quite salty, and sometimes they just kind of add a lot of it, so it becomes a high salt meal. So it's probably better to avoid soy sauce. Steamed foods are better than fried foods. Avoiding MSG is important. For diabetics, just some tips. Uncontrolled diabetes can lead to kidney problems. So healthy weight loss can help if somebody's overweight. And it's just really important to discuss the optimal diet with your provider and with the dietitian. Certain kidney conditions may have their own recommendations. I won't go into these specifically except just a few things because they're common. So patients with kidney stones or autosomal dominant polycystic kidney disease may be advised to drink a large amount of water and to limit sodium intake. So for kidney stones, there's a lot of dietary factors that may be important. So those are important to talk to your provider about. There's some evidence in certain type of stones that a low sodium diet may be helpful, and eating more fruits and vegetables may also be helpful. Okay, so we talked a lot about what not to eat, what to eat. It's a lot of information, but some people, or I think everyone wants to have some examples. The problem is that everyone is different. Everyone likes different things, and everyone may have different levels of kidney disease or diabetes or not. So I have some references at the end that you can look at. But here's just an example. This is from the American Kidney Fund. Just an example for a non-diabetic patient with stage 4 kidney disease. It just gives some examples, and I think examples are helpful to help guide you. Again, this is one example. So I'll leave this here for your reference to look at. And some of the things, don't look ideal, like the sugar, but I think they're trying to the point of this is, some people do like some of these other foods or additives, and so they're trying to find ways to say, okay, you can have a little bit, how do you incorporate that in your diet? Just a little bit. So I think that's helpful. Again, instead of saying you can't eat this ever, don't look at it. Patients will want to eat something. So how do you incorporate it? How much? So I think that's where this can be helpful, as well as meeting with the dietitian. So in summary, it's important to read food labels. Eating well may help prevent further kidney injury, as well as injury to other organs. The heart and the brain, they're very sensitive to salt. The exact dietary recommendations are not the same for everyone. And again, that's why I can't say, okay, everyone, follow this. And so you need to speak with your provider. I know I've said that about 30 times, but I really want to stress that because it's really not a one size fits all. So I apologize for being repetitive about that. It's just really important. And also meeting with dietitian may be very helpful, which I've said. So this is sort of a summary, but again, everyone's different. For non-dialysis chronic kidney disease, it's just a little bit of a guide to summarize what I spoke about. So I'll leave that for you to look at. So again, what can you eat? So there are nutritious carbohydrates, such as those found in grains, fruits, and vegetables. Keeping in mind, of course, potassium content, and that if you're diabetic, there may need to be adjustments. Healthy fats, such as canola and olive oil, may be increased for added calories. So there are people who, are a bit malnourished and need those extra calories. So that's a way to get some healthy fats as opposed to some other unhealthy choices. A limited amount of lean meats can be consumed, a limited amount. And just again, lean meats, not the fatty meats, but consider plant-based proteins such as soy and lentils instead of meat when possible. Here are some resources. Of course, there are many other resources. I tried to pick some. here that are, to give you some idea, because if you just look, you might find sources that may or may not be reliable. Again, this is not all of them, but these are some examples of reliable sources. Fresenius also has information as well. But these are some examples, and they also have links, some of them, to cookbooks where you can actually look at some diet plans and some options. And I think that's really helpful, like practical advice. So these are some diet humor. And it's maybe not so funny because it's actually sort of true, where, you've been told don't eat this, and it's actually something that has significant implications. So thank you very much. I appreciate you attending. Hopefully you learned something and can make positive changes to your diet. And thank you so much. I hope everyone stays healthy and safe.